Okay, so for infertility, how you define a couple actually described as infertility. Okay, the way we describe infertility means that they're being failed to conceive a child after 12 months of trying. Then a couple is described as being infertility if they fail to conceive a child after 12 months of trying. Okay, so what are the major causes of the infertility? So first, ovulatory disorder. So it means that's a hormonal problem. Okay, not enough LH to stimulate the release of the secondary oocyte. Okay, or endometriosis. Endometriosis basically means that's the inflammations of the uterine wall. Okay, oviduct blockage. So it means that there is a release of the secondary oocytes, but oviducts blocked. So it means that the sperm cells cannot fertilize the secondary oocyte. Or we have this for female, we have this anti-sperm antibody. So it means that the antibody release to target the sperm cells. So sperm cells will be killed, okay, or will be become cannot swim, without any motility. So therefore, the sperm cannot fertilize the secondary oocyte. So this one take place in female. Okay, then for male, it be absent of sperm, okay, or abnormal sperm. Like for example, they can't swim, okay, that are the problem. So this one is for male. So some cause of infertility cannot be corrected. For example, hormone, you still can use the hormones, okay, use the hormones to actually stimulate ovulations, right? Okay, or stimulates the follicle to develop. Okay, but some of them, like for example, anti-sperm antibody is very hard to actually to solve. So in case where spontaneous pregnancy does not happen, so couple may opt for the assisted reproductive technology. Okay, assisted reproductive technology that we have done it or discussed it previously. However, this type of treatment will involve significant financial, physical, psychological, and times commitments. Okay, first, it's quite expensive. It's roughly about 10 to 20K. It's not like 10 to 20 ringgits or 1,000 to 2,000, but it's about 10 to 20,000 in generally. Physically, because for IVF, female have to receive the injection, okay, hormonal therapy in this case. Psychologically, because you spend for so much and then the success rate is not very, very high. It's not guaranteed in this case, and definitely time commitments because it depends on the cycle you need to get the treatments. Okay, so the most common ART, okay, techniques in this case is in vitro fertilization. Okay, in vitro fertilization, or called IVF. Okay, so let us look at what is the process of IVF. So IVF actually involves two important parts here. First is the preparation. Second part is the transfer. Okay, so in vitro fertilization is a type of assisted reproductive technology that involves first we retrieve the female gamete from the woman's ovary, and then we fertilize it with the sperm cells that collected either from the husbands or the donor. Okay, so it depends if the husbands cannot produce sperm cells or the husbands cannot produce normal sperm cells. Therefore, then the girls may need to opt for the sperm donor. Okay, so the embryo can be frozen for storage. Okay, we can freeze the embryo for storage or transfer directly to the woman uterus if the woman's already prepared. Okay, now let us look at this process first. Okay, for in vitro fertilization, what we need to do at first part, the female have to receive. Okay, female have to receive the hormonal therapy. So what is this hormonal therapy need? Okay, hormonal therapy, because for the process is not, the success rate is not high. So if you do for normal cycle regulations, what will happen here is the follicle stimulating hormone, the FSH, is not strong enough to have multiple developments of the follicle, because we want to retrieve many follicles so that later we can increase the success rate. Okay, so first the female will be injected with the hormones called FSH, okay, follicle stimulating hormone. Okay, so when this follicle stimulating hormone is injected already, what will happen here is we want to stop, because we know that if we inject the FSH with a strong or higher concentration of FSH, what will happen here is this follicle will develop, release the estrogen, and it will cause the high concentration of the estrogens will cause the LH to release. So when LH release, therefore, one of these follicle, okay, or mature follicle, we're going to have the ovulation. Now, for female, any ovulations take place, it will stop the rest of the follicle to grow, because all follicle won't grow at the same speed. So means that if there is any ovulation take place of one or two follicle, the remaining follicle will stop growing. So mean at the end, we won't be able to collect sufficient secondary oocyte. Are you clear? The egg cells, right? So second, we're going to have what we call the GnRH inhibitor. Okay, either agonist or antagonist. Okay, I will explain this later. So with the GnRH inhibitor, we inhibit the GnRH to bind. So means that LH won't be able to be released. So therefore, female won't have ovulation. Are you clear? During the treatments of the hormone. So make sure that all of the follicles still remain intact inside the ovary. Okay, so the next process, what we're going to do here is we're going to take the, okay, or retrieve the secondary oocytes from the ovary, because there's no ovulations, right? We stop the ovulation take place. Then after that, we prepare the sperms, either from husbands or the donor or from the sperm bank. And then we allow the egg cells to be fertilized, or secondary oocyte to fertilize with the sperm cells. And then we have the embryo developments. Once you already get the sufficient cells, then we can do the embryo transfer and let the implantation to take place. But in this process, we have to know that, okay, we may opt for the pre-implantation genetic screening, pre-implantation genetic screening first, so that we do not want to have any, the children's with the genetic disorder or severe genetic disorder. Okay, and generally, even though here you can see 3 embryo, but the regulations in Malaysia, you only, the center only allowed to transfer 2. Are you clear? Transfer max 2, and no gender selection is allowed. Okay. So let us look at this, and then I will continue with the descriptions later. So first of all, we're going to have during the ovarian hyperstimulations, injectable gonadotrophin, usually FSH analogs, are generally used under the close monitor. So first, we inject FSH. Okay. So second, okay, so following ovarian hyperstimulation, suppression of spontaneous ovulation is included, for which 2 main methods are available. Either you use a GnRH agonist, usually long durations, or GnRH antagonist protocol, usually shorter. So it means that if you want to have a longer, then we have to use this GnRH agonist. If you use a GnRH antagonist, basically you block the receptor. You block the GnRH receptor. Then you do not need to inject from the first day. You can inject after about like 6 days after the treatments. Okay, so why? Because we want to suppress the spontaneous ovulation. Why we want to stop the spontaneous ovulation? Because any ovulations, one ovulation take place, then the rest of the follicle will stop to grow. So no point. That means we have the hyperstimulations. Okay, and for your syllabus, you just need to know we need to suppress the spontaneous ovulation by using either GnRH agonist or GnRH antagonist. You choose either one of them, and no need to explain much. Are you clear how the GnRH actually block the receptor? Okay. And next, when the ovarian follicle have reached a certain degree of development, so induction of final oocyte maturation is performed. Okay, how we can do this? We inject the HCG to make sure that now oocyte final maturation take place. So the secondary oocyte are retrieved from the patient using a transvaginal technique known as transvaginal oocyte retrieval, involving an ultrasound guided needle piercing the vaginal wall to reach the ovary. Can you see that? This is the method. So under the sedations and the NS, okay, so then you can see that you will be able to actually put the needle in and then retrieve the secondary oocyte. Okay. Then after that, the semen is prepared also for the fertilization by removing inactive cells and seminal fluids in the process called sperm washing. So we just need some active cells to be available. Okay, and in order to increase the rate of success rates, now they go for ICIS, intracytoplasm sperm injections. Basically, they use the sperm, they inject, right? It's not natural process. We inject the sperm into the cytoplasm of the secondary oocyte. It's called ICIS. Okay, intracytoplasmic sperm injections, if not mistaken, ICIS. So this is the method to increase the success rates. Okay, wait, I will show you. And then the sperm and eggs are incubated together in the culture medium in order for the actual fertilization to take place. And after fertilizations, so during embryo transfer, a soft transfer catheter is loaded with the embryo, and the catheter is inserted through the cervical canal and advance into the uterine cavity, therefore allow the implantation to take place. So this is the IVF techniques, okay? IVF techniques. So other techniques sometimes also, okay, used in the IVF, okay, together with IVF, for example, intracytoplasmic, just now I say that, intracytoplasmic sperm injection, ICSI, or assisted hatching, donor egg or sperm, and also gestational carrier. Okay, so we're going to look at what is there, all of them. So one of these you may want to put it in the essay question talking about IVF is the first one only. The rest is not in our syllabus. Okay, so we look at what's meant ICIS, or this intracytoplasmic sperm injection. Basically, during this in vitro fertilization, in which a single sperm cell is injected directly. So we don't actually allow the sperm cell to bind to fertilize the secondary oocyte, but we actually inject it in. So you can see that, guys, in this process, you have these thick coats, right? The thick jelly coat. This is secondary oocyte. So we use a needle, okay? Then we transfer the sperm cell into the cytoplasm of the secondary oocyte. So this technique often do it when we have a very poor semen quality or quantity, or fertilization attempt during the prior IVF cycle, is failed. So it means that the sperm cell may not have the ability to fertilize the secondary oocyte. So what we can do, we can use a needle, take the sperm cells and then inject into this. So we have the supporting what we call the matrix here, or the solid here, to write something like whole. So allow this secondary oocyte to stay, and then we inject it. Okay, so increase the rates of the fertilization. Second, we look at this, what we call the assisted hatching, not in our syllabus. So once embryo are created using IVF, the embryo is surrounded by the hard outer layer of the cell known as the zona pellucida. Can you see that? The hard outer. So embryo must break free from this hard outer layer in order to be implanted into the uterus. Correct or not? Okay. So, but the problem here is sometimes they won't be able to have this, what we call the hatching process, to free the embryo. This can see that these are embryo, but it's surrounded by this. So how to do this? We can use a laser, a procedure where we can help the embryo hatch from its outer layer, so that now we release the embryo, allow the embryo to implant. Okay. Donor egg or sperm. So most ART done by using the couple own egg and the sperm cells. But however, if a severe problem with either egg or sperm cell, the couple may choose to use egg or sperm cells or embryo from the known or an anonymous donor. Gestational carrier basically is surrogate's mother. So women who don't have the functional uterus, or for those who pregnancy process a serious health risk, might choose to have the gestational carrier. So in this case, the couple embryo is placed in the uterus of the carrier for the pregnancy. So basically means that we get a surrogate mother. Okay, so what are the ethical implications in the in vitro fertilization? What are the ethical question here is, generally 2 5 days old embryo are transferred. However, some doctors prefer to transfer more embryo. This can lead to multiple embryo development in the uterus, which is less likely to be healthy than a single one. Okay, so is it possible for women to have a children using a sperm from a man who is not her partner? So some people believe it's not ethically acceptable. For example, the donor. Okay, and there's also difficulty if the man who donated the sperm does not want any resulting children to know he is the father. So a lot of these ethical concern here. And also, if the super donor, what means super donor means that the man that donates. So many women use his sperm. What will happen here is, in one day, okay, theoretically, the children are the sibling from different women. They are sibling because they come from the same father. So if let's say they fall in love and then they get married, then against ethical and also the moral issues take place here. Okay. So it's possible for a woman who is long past the childbearing age and who has reached the menopause to have the children in this way. Correct or not? Because they can have a surrogate mother. So this could mean that the child is born to a mother who will not have a sufficiently long active life to care for him or her. Okay. So while many people think that it is important and that a woman should have, I don't know why I mean typo, right? The right to bear a child, others feel that there are enough children in the world already that a person who is biologically unable to have one should not be treated. So there is argument saying that there is a type of control. They should adopt a child rather than give birth to their own child. Okay, some of the embryo results from the IVF will not be implanted. They could be allowed to die or could be used for research. Some people are concerned that they do not have the right to dispose the embryo because it might be living in this case. Okay, it's considered living. So it's possible for semen from the partner to be collected and frozen. A woman could then have his child by IVF after the partnership had broken up or after he has died without his permission. So in this case, without the permission, is it allowed or not? Okay. And last, the embryo produced by IVF are usually tested to ensure they are viable before implanting them. This may include checking of the presence of undesirable alleles, such as those can cause a genetic disorder, for example, cystic fibrosis. So it's possible to choose the embryo for a particular sex. So therefore, we have a wide variation of people view in the ethic of this choice. So these are the ethical concern regarding to the IVF.